Hello everyone. I'm going to be doing the IV insertion and removal for a 50-year-old male that came in for dehydration. So I've already performed hand hygiene, prepared my supplies to do the procedure. So I'm going to apply the tourniquet, not too tight. I'm gonna feel for a pulse, ensuring that the tourniquet is not on too tight. And then after that, I'll clean the area, do about 4 to 6 inches away from the tourniquet, and I'm gonna do it out from the middle and outward motion. With my non-dominant hand, I'm gonna pull the skin towards me, ensuring that it's taut. I'm gonna use a 20 gauge needle. That's what I have, and it's what's gonna be used for the patient for his IV hydration. I'm gonna remove the cap, pulling the skin taut, inserting about 2/3 of the way. I'm going to see some blood flow in the chamber, and when I see that, I can proceed with pushing further the catheter tip. A little more. There you go. And I'm gonna put this in my sharps container. And after that, I'm gonna quickly install my luer lock in it, keeping my non-dominant hand stabilizing the IV catheter. I'm going to aspirate, make sure that there's blood flow, and then push it back in to ensure that there's okay. And then I'm gonna clamp it. Okay. And then after that, I'm going to apply the Tegaderm or the sterile dressing, keeping it in place. Okay. And then I'm going to initial, date, and write the gauge of the needle that I used. I'm gonna get some tape and reinforce the area of the base of the catheter. And then I'm going to reinforce the luer lock as well beside it. Now that it's clamped, I can take this off. Get another piece of tape. And place it as so. And then I'll wait for the IV to finish, running. And then after the IV is finished running, I'll remove this as well. Now that it's all good, I will wait for the IV to be finished, And to remove it, I will perform hand hygiene, put on clean gloves, take off the tape with my dominant hand, keeping the catheter in place with my non-dominant hand. I'm gonna get an alcohol swab to kind of press on the site, and I'm gonna pull the catheter tip parallel from the skin. I'm gonna put that in the sharps container. I'm gonna put my gauze, apply direct pressure for 30 seconds, wait for signs of, clotting, no more bleeding. And then once that happens, I can remove the gauze or reinforce it with like Coban to make sure it's there. And then I'll clean up my supplies and the procedure is over. And then I'll remove my gloves, perform hand hygiene, and clean everything up.